Well, hello there, and welcome to the break room. Listen, okay, so in preparing for our time today, I was actually looking at some memes. Um, I can't remember. I think I've seen it on YouTube as well as I've seen it on Facebook. But listen, one would say, if tired was a person, and then it have someone like really just laid out of exhaustion. Or there was one I think I saw, if Monday was a person and had a person with their hair just all over the place and basically crying like, okay, it's Monday. So as I was looking at those, the thought came to mind, listen, if self-care was a lab test, what would be your lab results? Think about that. All right, we're going to get into it. We're going to get into it. So again, welcome to the break room. So glad to have you here. And I really want to just say to each of you for joining or tuning in or viewing. I thank you so much. If you are new here, welcome. So glad that you took the time to come by to view. And then those of you that have been here for a while, thank you so much for coming back, because you could be anywhere else, but I'm so glad that you're here. So again, this is the break room. This is your self-care escape, if you will, to escape from your self-care safe space, if I can get my words out, the self-care safe space, so that you can escape just briefly from the day-to-day things, so that you can be refreshed and renewed, and then you can return back to those things that you have to do. And then I am Deetra Dennis. I am the self-care coach for nurses. And what I do, I empower multi-passionate nurses to prioritize the care of their MVP. Yes, you are your most valuable patient. And when you do that, you're able to show up as the best version of yourself and impact the well-being of those connected to you. So that is why we're here today. And in the break room, it's, I try to keep our time together brief but impactful and powerful, things that you can take away so that you can implement once we're done. All right. So again, today we're talking about if self-care was a lab. Listen, if it was a lab, what would be your results? So let's take it back a little bit. Let's go back again to the fundamentals of nursing and really thinking about what lab tests are and what usually is the purpose of a lab test. So, we know that it's a sample of, it could be your blood, urine, tissue, but what it's basically doing is, it could, depending on the test, it could identify changes in a health condition. It could be used to diagnosis or a condition. It could be used for a treatment plan, or to monitor levels or evaluate the response of a treatment, or even to monitor the course of a disease over time, or even think about biometric screenings or testing. That is usually to give you a clear picture of your overall health. And so when I think about those lab results, the lab results can have can be abnormal, can be normal, can be low, can be high. It could be critical levels, a critical high or a critical low. And so when I thought about that, let's think about, again, if self-care was a lab test. And I want to share some statistics with you, and then let us come together and think about, well, what would that level be? And so as a refresher, just to level set, self-care is a deliberate or intentional activities that we do to provide care for our social, physical, mental, emotional, and spiritual well-being. Okay. And so according to, listen at this, and then let's together decide what that level is, okay? So, according to data collected from the Healthy Nurses Survey by the American Nurses Association, 70% of the nurses said that they put the health, safety, and wellness of their patients before their own. So basically, self-care is on the back burner, right? They're putting everyone else before themselves. Not that you're not going to take care of them, if you change that, self-care is on the back burner. So let's think about that. So if self-care was a lab test, when we're looking at these numbers globally in the nursing profession and nursing in the healthcare industry, for the nursing career, I would say that if self-care was a lab test, that result globally is a critical low. Do you agree with me? Type in the chat if you agree. And so to me, this requires urgent and intensive attention. So even though the numbers that we mentioned right there, the 70%, is a collective number, let's take it a little granular and let's ask ourselves, if we were to have a self-care, if self-care was a lab test, what would our or yours or my self-care, what would be our lab result? What would be our result? And so when we talk about that, I really want to, again, I'm talking to the multi-passionate nurse, that nursing extends past the career. It goes into, you're still serving as a nurse in your community. You are serving to those that are connected to you, your family, your friends, and your faith community. So it is so important for us to have self-care. But if self-care was a lab test for you as a multi-passionate nurse, for you, what would be your result? What would be your result? And so it requires some self-reflection and self-assessment. You know the nursing process. It all begins with an assessment, because you have to know where a person is before you can create a care plan for them, right? So this is our nursing process together. Come on, we're going to do it together. The self-reflection, what would be your result? So I want to further share what self-reflection is, because we want to be intentional about self-reflection practices, right? Because it's a powerful way, I feel, for us to take that critical low level of self-care to within normal limits, right? So that it's normal. But let's think about what the American Psychological Association, how they define self-reflection. So they define it as the examination or contemplation and analysis of one's thoughts, feelings, and actions. And they go on to even describe self-reflective awareness as the most crucial life skill a person can have. That's a lot, right? So self-reflection here to me is very important. And I feel that self-reflection will help us move the needle. I won't say needle, move the level from a critical to within normal limits. So as a result of self-reflection, here are some things that can occur. One, it reveals, number one, what needs improving. And so you can identify your weaknesses and turn them into strengths, or get the support you need in those areas of opportunity or areas of weakness, right? Get the support that you need. Number two, it makes you more self-aware. And now listen, the psychologist also mentioned this about self-awareness. Now it said that research is linked to higher levels of creativity and confidence when we practice intentional self-reflection. Number 3, it improves our motivation. Last week we talked about when we were talking about work-life harmony, and we mentioned with burnout, usually the motivation is, very low. But here's another way, also just like work-life harmony, but here is also another way to improve motivation is by practicing intentional self-reflection. The 4th thing is it improves your quality of life, right? With doing that self-reflection. And lastly, it improves your quality of care, the quality of care that you're able to provide. Now, when we're stressed and when we're on that path to burnout, many times, and research has shown that we're not fully present, and it's really called absenteeism, because your body physically is there, but your mind is elsewhere. And I'm chuckling because the song that comes to mind by the OJs, your body is here with me, but your mind is on the other side of town. That's what happens. But when you have that self-reflection, it allows you to improve the quality of care that you're providing. And I don't know about you, but I know for me, it's so important for me to give quality care in every aspect that I am serving someone, right? Quality is just important to me. And I know because we are alike, it is important to you as well. So those are 5 ways by doing the self-reflection. And I feel that it will improve that the lab result for your self-care from a critical low to within normal limits. So that's all I have for us today. And I know that you found value with this. So I also know that you will share this with someone else who will benefit from the things that we talk about here in the break room. So, I love to hear from you. So I want to ask you, when you practice self-reflection, what are some benefits that you receive or experience when you practice self-reflection? Intentional self-reflection. All right, so listen, the quote for today. This one is a real good one. All of them are good, but this one is really good. Okay, so lean in. All right, so here it is. Your soul needs time for solitude and self-reflection. It is like an intimate date with yourself. And what happens from that, in order to love, lead, heal, and create, you must nourish yourself first. I'm going to repeat that one again. I'm going to repeat it again. I want you to get it in your spirit, get it in your soul. So here it is. Your soul needs time for solitude and self-reflection. It is an intimate date with yourself. In order to love, lead, heal, and create, you must nourish yourself first. So again, thank you so much for tuning in. I really appreciate you investing time in yourself to spend with me. So I really appreciate it. And I wish for you a wonderful week. And I look forward to seeing you again next week this time.